for me on the 19th of December. My God, I'm a grown guy. Tonsillitis, I had my tonsils out. I did. Swollen. God, that hurts to have your tonsils out. Christmas was cream of wheat. Cold cream of wheat would have been, was what I was eating. Warm would have been too much. When I went back on the 27th, 2 days after Christmas, they said, Wes, you have to walk through the dark valley, Wes. Wes, you have cancer. For the first time in 41 years, I do not have employment-based insurance. I was a fireman for 16 years. I worked with occupational health and safety for a number of years. And, you know, it's just the way they rolled out. And the bills are coming in, and I just don't have the money to do it. Okay. That is an introduction to Tanya Ray. My daughter, Tanya Ray, oh my God, she was diagnosed in 2000 with leukemia. Yes, she was. Tanya, 2 years later, because she wasn't in remission any longer, had a bone marrow transplant at OHSU. And in fact, it was the graft versus host disease that did kill Tanya. Tanya died 4 years ago, January 31st, just anniversary year, 4 years ago, just a couple of days ago. I want to tell you what happened with Tanya. 9 years of struggle with leukemia, but you know the struggle that Tanya had was with the insurance companies to have access to health care. Every step of the way, they put up barricades for my daughter. They treated like a dog in an alley. We can do better than that, and I want to talk about the third part, my third minute, right now, and it's about us as Oregonians. I'm so proud to be an Oregonian, and I'm proud of who's here today. We are from all over the state of Oregon, and we are diversified, and you know what we have in common? We know as Oregonians that we can change things for the better and take back health care. We know that, don't we?
Everybody in, nobody out. Everybody in, nobody out.
How's everybody doing? I can't hear you. How we doing? I want you to repeat after me. Repeat after me. We can fix it.
We can fix it
without a fight.
without a fight.
Healthcare is a human right. We can fix it without a fight. Healthcare is a human right. In the air like you just don't care for healthcare healing, y'all. Come on, there's a party going on up here in Salem today, y'all. Look out. We're hearing the healthcare blues as a community. Somebody say yeah. Yeah. Everybody in and nobody out. Well, I don't care what party you're in, Democrat or Republican. Well, I don't care what party you're in, Democrat or Republican. Healing the healthcare blue, the only way we can win. Everybody in and nobody out, that's what it's all about. Out. It's up to me and you. Heal the healthcare blue. That's what we're trying to do. Everybody in and nobody out. That's what it's all about. In Salem today, somebody say yeah. Everybody in and nobody out. It's up to me and you. Heal the healthcare blues. That's what we're trying to do. a human right. We can do it without a fight. Healthcare is a human right. We can do it without a fight. Healthcare is a human right. Everybody, put your hands right here. All right. You hear that sound right there? That's us working together. All right, right there. That's beautiful. Because together, we can achieve anything. This is the land of the free, home of the brave. All we're saying is we want to be the home of the healthy as well. Am I right? Home of the healthy as well.
In VA, in HMOs, in the most technically advanced health centers, and in free clinics with donated supplies. And in almost 30 years as a physician in Oregon, what I've learned is that healthcare is a human right. I did not learn this from the faculty in medical school. I learned it from the people I've had the privilege of caring for over these years. I learned it from a young man with diabetes. His father lost his health insurance, couldn't pay tuition, dropped out of college. The boy couldn't afford the insulin he needed to stay alive. He couldn't afford a physician to prescribe insulin for him. I learned it from a woman who cleans houses for a living, with arthritis in her knees and climbs up and down stairs all day, comes into the free clinic in the evening to get some medication just so she can keep on working. I learned it from a middle-aged couple, lost the job, lost the insurance, lost their medicines. The diabetes got out of control, the high blood pressure got out of control, the heart trouble got out of control, and finally they came into the free clinic because they had no health care, no other options. I learned it from a man with pain in his abdomen, like some of the stories you've heard this morning. He put up with the pain until finally he could endure it no longer. And by the time he came to see us, his liver cancer was not treatable and he died. There's millions of stories like that. Any doctor, any nurse, anybody that does healthcare, all of you know stories like that, and it's not right. Healthcare is a human right. How many here have ever gone without health insurance because they finished school, were between jobs, etc.? Yes. How many here have gone without health care, delayed health care because of costs, high deductibles? Of course. It's not right. About 1 in 6 people have no access to care. About 1 in 3 people who have insurance put off care or do without it because they can't afford the deductibles. 45,000 people die in the United States every year because they do not have access to health care. Over 500 people in Oregon, that's 10 every week, die because they have no access to health care. Not because we can't figure out how to care for them. Not because we don't have treatments, but because we refuse to care for them. Healthcare is a human right. People tell me this is not realistic, that it's not feasible. Doctors, CEOs, politicians, they say, oh yeah, Gorman, of course I believe in universal care, but it's just not feasible. If I had a nickel for everybody that told me it's not feasible. Of course, that's what they said about lots of reforms, about women's suffrage. They told Elizabeth Cady Stanton not to demand the women's vote because it would seem ridiculous. But it doesn't look so ridiculous in retrospect, does it? They waited 72 years for the vote. We waited 100 years since Teddy Roosevelt called for universal health care to get it passed here in the United States and in Oregon. So I want to thank you all for being here. It's time to tell our leaders that it's time to step out and have the courage, like Michael Denbrough and the other correspondents that sponsored this bill. Healthcare is a human right. 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 Thank you. Thank you all for being here.
We can do it without a fight. Healthcare is a human right.
Of you think that the system, or let's say the condition that we now have, gives every Oregonian that right? How many of you believe that the Affordable Care Act and the public exchanges, the healthcare exchanges in Oregon, are going to guarantee that right? How many of you are willing to do what it takes to secure that fundamental right for every Oregonian? And you are part of a movement, a beautiful movement, and you have come to the right place. Now, why is this the right place? Is that because the solution to our healthcare tragedy is going to be solved by the legislators in this building? How about by the governor? No. It's going to be solved by 1 million people in the state of Oregon. This will happen by the people of Oregon demanding change, organizing for change, and voting for change. And that's why we're here today. As a result of the Federal Affordable Care Act, we cannot have a single payer system in this country, in this state, before 2017. Okay, that's a bad thing. It's a bad thing and it's a good thing. It's a bad thing because we need a system like that today. We needed a system like that yesterday, right? But it's a good thing because it gives us 3 years to develop this movement. It gives us 3 years to develop the healthcare for all Oregon system, one that's been well researched, that's right for Oregon, and that will be supported by the people of Oregon. It gives us the next few years to build a movement for victory. So we have a legislative concept. It's legislative concept 1914, easy to remember. It's the beginning of the Great War. And that articulates the Healthcare for All Oregon Act, which builds off of House Bill 3510 from last session. You may remember that House Bill 3510 had 11 co-sponsors on that bill. Our goal for this session is to double that number of co-sponsors. How many of you think we can do that? But brothers and sisters, the real work here is not going to be done inside this building. It's going to be done outside of this building, all around the great state of Oregon, by you and by wonderful organizations like Healthcare for All Oregon, Jobs with Justice, Physicians for a National Health Plan, all the groups that are going to be working together, labor unions, social justice organizations, all working for the public good. Because getting the system that we want and need will ultimately require a vote of the people. Ideally in the November 2016 election. Now, to win an election for a bill like this in Oregon requires 1 million votes, roughly. 900,000, 1 million votes. Wow, what a daunting prospect. especially because we need those million voters to withstand the barrage of negative advertising that you know is going to come, and you know who it's going to come from. You know, the brothers said this is going to be without a fight, but I hate to tell you, they're going to be fighting this. We don't necessarily need to fight back. We need to organize. Right? I mean, look around you. We have about 1,000 people here, right? Okay. How many of you think that in the next year, you can get 100 people to sign a statement saying that healthcare is a fundamental human right? And of those 100, do you think you could find 10 people who could get 100 themselves to sign such a statement?
Foster, where's Foster?
All right, so
I bet we can.
So I was an English major, so I'm not really good at math, but 1,000 times 10 is 10,000, and 10,000 times 100. No. Anyway, it's a million.
He said quit it.
So how many of you share this vision and are willing to commit to doing the work that it's going to take? Then let's go forward and organize this state. Everybody in, nobody out.
What do you think, everybody? Do you think we could do that?